Hi there, welcome back once again to the Parkinson's Disease Education Podcast. We're going to be talking about runny nose and Parkinson's disease, or better known as the medical term rhinorrhea. Now, if you heard the term rhinorrhea and thought, that sounds an awful lot like a rhinoceros that had a bad case of tacos, well, that means two things. One, we're probably kindred spirits, but number two, it means you should keep watching this video to find out exactly what the heck this has to do with Parkinson's disease. You may not have even known that this was a connection. I certainly know from the polls that we put out that people are interested in this topic, to the tune of about 45% of those that answered the poll. So stick around. We're going to be talking about the potential causes of runny nose and Parkinson's disease, as well as treatment options and what that could mean for you. Get on the other side of the intro, and let's go. Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. So, runny nose and Parkinson's disease. It's a topic that's just dripping with intrigue, would you agree? But in all seriousness, this is actually a rather uncommon non-motor symptom of Parkinson's disease. It's uncommon enough that most people would not find it common knowledge to link the two. In fact, it's only as high as around 20% of individuals with Parkinson's disease that experience this. But in my personal experience treating persons with Parkinson's, it's fairly common. And when I say that, I mean I've known multiple patients that I've worked with as a therapist that have had this non-motor symptom. Now, it's said that rhinorrhea, which quite literally means fluid running from the nose, is potentially something that could show up before Parkinson's diagnosis. Even though it's a non-motor symptom, it could be an early sign. Now, the tricky part is a lot of folks that are relatively older in age, let's say 65 plus, but especially 70, 80 plus, this can actually show up in individuals without Parkinson's as well. Again, I've seen this actually put side by side with things like REM sleep behavioral disorder, which is often an early sign of Parkinson's disease, but apparently rhinorrhea or runny nose can be as well in individuals that might have it. So I think one of the most interesting facts about rhinorrhea or runny nose and Parkinson's is that we really don't know exactly why it happens, even in this day and age. So further research is needed to kind of rule in and rule out causes that could actually help to treat it, but we're going to talk about treatments in a little bit. Now, there are some medications that folks with Parkinson's may take that could potentially cause runny nose as a side effect. One example would be apomorphine, which is a form of dopamine agonist. For those that have this condition without taking medication like apomorphine, it's just very likely directly related to the Parkinson's itself. It's said that Lewy bodies may also have a connection with the runny nose because Lewy bodies can disrupt some of the autonomic nervous system function, but then again, that happens in Parkinson's disease with or without Lewy bodies. The bottom line really about cause is that we know already that Parkinson's disease has direct effects on damaging the autonomic nervous system, and we know that secretions in the nasal mucosa are directly linked to the autonomic nervous system. That's controlled by the autonomic nervous system. So it's not that far of a leap to think that there's a link between Parkinson's, the autonomic nervous system disorders that can happen, and the fact that some people get runny nose. As a matter of fact, autonomic nervous system disorders with regard to rhinorrhea have been labeled what's called vasomotor rhinitis. The term vasomotor rhinitis actually kind of indirectly indicates that it's related somehow to maybe the blood vessels in the nose. That kind of leads us into treatment of the condition, regardless of what causes it. It is something that can be problematic, and that's why treatment is important in some individuals. Now, aside from being a little bit annoying, rhinorrhea can actually be, frankly, humiliating. There are stories from individuals with Parkinson's that have had this problem where they literally can't go to a public restaurant to eat because their nose is literally dripping into their food. I know that sounds gross, but you can imagine how embarrassing that would be to try to go to dinner or lunch with a friend or family member or heaven forbid, somebody you have business connections with, and you're dripping into your food. That's a more extreme case, but it is something that's anecdotally happened that I've read about online. And so you definitely could have people that really need to get treatment for this. And luckily, the treatment is not complicated, although it may have some side effects that aren't as desirable. The treatment isn't radical, it's just a nasal spray. One of the most common nasal sprays you'll find to treat this condition is ipratropium bromide. Ipratropium is an anticholinergic medication, and the way that it works is to essentially dilate the blood vessels in the nasal mucosa. Ipratropium bromide is most commonly found in the brand name Atrovent, and you'll see it as an inhaler used for conditions like asthma and COPD, but also it comes in nasal spray form. In either case, it's going to help to block acetylcholine because it's an anticholinergic, and the acetylcholine blocking will effectively dilate blood vessels and dilate bronchial passageways. So it helps open things up. So it could increase blood flow and then increase airflow in the case of the lung tissues. The drawback to this, though, is that there are some localized side effects that could be undesirable, such as dry mouth. You can also have dry throat, constipation. You can also have urinary retention and lowered blood pressure because of the blood vessels getting dilated. You can have lowered blood pressure. So there are some drawbacks, but then again, if your rhinorrhea is bad enough to get medicated for it, it probably may outweigh the negative, or the benefits may outweigh the cost of taking such a medication. Now, the good news about something like ipratropium bromide spray is that it's not going to cross the blood-brain barrier. So you're not necessarily at risk of having, let's say, some of the memory issues that can be associated with anticholinergics when they're taken in oral form to help with Parkinson's symptoms. We've talked about that on prior episodes. So, in conclusion, it's not all in your head, or maybe it kind of is, but what I really mean is you're not imagining it. If you've had Parkinson's disease, also happen to have runny nose and wondered, my gosh, why does my nose run so much? Well, now you have a potential connection there. It's very likely it's related to Parkinson's, and you're probably among that about 20% of individuals that actually experience this condition. One quick side note before we conclude is that loss of smell, or anosmia, can also be a side effect of Parkinson's disease as a non-motor symptom. It can occur at the same time as something like rhinorrhea or runny nose, although they can happen separately. So just because you have a loss of smell does not mean you're going to have runny nose, and vice versa. Or you could have both. It just depends on the individual. So I hope you enjoyed this episode. Leave your comments below letting me know your experience, if you have this issue with Parkinson's disease or not, or if you just learned something new today and thought it was interesting. Either way, I'd love to hear from you. Please consider joining our memberships and look at all of the links to support our channel sponsors in the description and in the link section of the channel. Well, I had fun. I hope you did. There was fun. We had some puns. And speaking of runny nose, I've got to run. I'll catch you in the next episode. As always, be empowered. I hope you have a great week.